At the Cleveland Clinic, you're the director of sports medicine research. Can you tell us, in the research that you've done, have you found things that have helped you change the way that you prepare athletes for their sport?
Yes, I think we certainly have in several different areas. For instance, you mentioned concussion and it being in the news, and I think as we look at this more, we see that, again, not all injuries are the same, and the individual that actually gets concussed may change our recommendations for return to play and how aggressive we are or how fast we pursue that. Obviously, no athlete that's symptomatic should return back to play when they remain symptomatic. But we also know that certain athletes may be at higher risk for having more prolonged symptoms or at higher risk for concussion in general. For instance, through some of our analysis of our neuropsych data, we were able to see that athletes that have a history of learning disability or ADHD may be at higher risk for concussion compared to those athletes without those conditions, so that there certainly may be a role to being a little bit more cautious in those groups of athletes. We've also seen that there are groups doing jump training programs. We are, as well as other groups around the country, as methods of trying to prevent ACL injuries, and we have groups that are currently studying how effective these measures are here at the clinic. We're even doing a study with biomarkers looking at concussion to see if that may be helpful for returning athletes to play. Basically, we're running a blood test to see if there is an injury marker that we can use to help us guide us in terms of return to play for concussion, sort of like a troponin test. And if someone has a heart attack, their heart leaks some enzymes that they can check in the blood to show that they've had an injury to their heart. We believe that there are similar markers that occur in the brain that we might be able to find and help guide those return to play assessment and evaluations.